Dr. Lesley Bamford is a specialist and acting chief director at the National Health Department of Health and at the National Department of Health, and joins us now to reflect on 2 years of COVID-19 in South Africa. Doctor, thank you very, very much for your time. Welcome.
Good morning, and good morning to the viewers.
So, Dr. Bamford, I suppose we have travelled a very bumpy and difficult road over these last 2 years, but, you know, it has been quite comforting seeing and reading numbers lately where, on days there are, no deaths, which we are reporting today overnight. The numbers are now, infection rate below 5%, which is the worrying level. This has been sort of a tough time to get here, but what do you make of where we are right now? Are things very much so under control?
Well, I think you're quite right. I think currently things are under control. As you indicate, there are few cases and extremely few, if any, deaths. Having said that, I think we need to not believe that COVID-19, that the pandemic is necessarily over. We know that we've had 4 waves, and each wave was associated with the emergence of a new variant. And we don't anticipate another wave unless a new variant emerges. And that is, of course, the great unknown. So now that the cases are low, it allows us to open things up. But we need to remain vigilant and to maintain our preparedness because it's likely COVID will be with us for some time. And we can anticipate that there will be further waves.
Yeah, I mean, let's dwell on that for a moment. Just in terms of what we're seeing unfolding in China, obviously we're seeing again one of the biggest outbreaks that's taking place in China right now as we speak, and lockdown is happening there of millions of residents. The numbers have not been this high since the start of the pandemic, and if we go back, this is where it all started. Are they going through what we have already been through? I think it's the strain of Omicron, but is there more to this? What are we hearing?
Well, I think every country is different. And in South Africa, we know that we do now have relatively high levels of immunity or protection against COVID-19 as a result both of vaccination and also of a large number of natural infections. So currently, South Africans do have relatively high levels of protection, but that certainly means that some people remain vulnerable. So just to stress that. However, in China, because infections to date have been very low, the situation has been contained there, there's much less protection against COVID-19. And they are experiencing a new variant, a variant that is new to them. And that the pattern is that results in a high number of infections.
Indeed. And that is Omicron. There's no other variant that we're aware of. Yes, we hear about that. I think it's BA.2 or something, but that we've already got here. So there are no alarm bells ringing, is what I suppose the big question I'm asking. No new variants doing the rounds, no things at this point that have been identified that we as South Africans should be concerned about.
Exactly.
Okay.
So in South Africa, the 4th wave was associated with the Omicron variant. We have been through that wave. And as indicated, it's unlikely that we will have another wave unless a new variant emerges.
Okay.
Currently, there are no indications that a new variant is on its way. But remember that these variants do emerge and spread very quickly.
Indeed. And we are, I think, all of us have become sort of experts in that field, whether we wanted to or not. But I think we all focused on it for so long. So having said that, and we see things under control at the moment, do you think the national state of disaster should end? Do you think we should sort of start picking up our lives the way they were, obviously living alongside this virus that is not going anywhere, but we just need to live alongside it?
Well, I think there's consensus that is what we need to do. The national state of disaster will end, as indicated by the president. There are some issues around the exact timing of that. As I indicated, we need to remain vigilant and make sure that we are prepared in case we do experience another severe wave. But we need to open up society, open up the economy. In the health sector, we need to refocus on providing other services because there certainly has been disruption to other services during the pandemic. We do, however, need to make sure that, as I indicated, that we remain vigilant. We know that our immunization rates are still suboptimal, and really that remains the best way for people to protect themselves. There are many South Africans who still remain unvaccinated, and as I'm sure you're aware, we have opened up for booster shots as well. And so we would really urge people, both those who haven't been vaccinated at all, or people who may have had 1 or 2 doses but not their booster doses, to really get vaccinated. Because as we open up society, we do become more vulnerable to infection. And whilst we're seeing few hospitalizations and few deaths, as we open up, people who are not protected are likely to become infected and can become very ill and even die.
Yeah. Let's talk about the vaccination drive that government has been on, and I mean the government had previously targeted to have around about 70% of the population vaccinated. That certainly is not the number that we sit with right now. What are we looking at? I mean, if we had to look at the percentage of South Africans that are fully vaccinated, and what actually is the definition of fully vaccinated now? Is it having the double vaccine and the booster? Is it just one vaccine depending on what you've had? What is the definition of fully vaccinated now?
So that's a good question, and you know, over the last 2 years, the science of understanding of both the disease and vaccination has moved very rapidly. And we've needed to keep up with developments and more understanding. So currently, as we speak, we still consider anyone who has had 2 doses of the Pfizer vaccine or 1 dose of the J&J or Janssen vaccine to be fully vaccinated, and that's the definition we use when we are reporting. However, that is under review, because certainly the recommendations are that people who are eligible to receive a booster dose receive that dose. And in some instances, people are now eligible to receive 2 booster doses.
Yeah.
So I think this is a field that, or an area that is evolving, and we will announce any changes that we make as we go forward. But certainly it's true that fewer South Africans are vaccinated than we had hoped, and we continue to provide vaccination and really to encourage people to come forward and vaccinate. We will be placing more emphasis on ensuring that vaccinations are available through our routine health services during the course of the year. That should make vaccination more convenient for people. It's also part of the process of learning to live with COVID-19. We still need to vaccinate, but it needs to be part of a broader package of health services that we deliver.
Indeed. And I mean, I'm even seeing now that Pfizer's CEO says a 4th dose of its COVID vaccine is now necessary to fight new variants that have come up. So, I mean, this is just, it just seems that we're going to be getting vaccinated all the time. I know everybody equates it to the flu vaccine, something that you get on an annual basis. Is that what it looks like? From what I'm seeing, I mean, now urging people to get a 4th vaccine, even though I mean, if we look at the continent, so many millions haven't even received one dose as yet, but that's a separate conversation. But in terms of having this annually, if not more than annually, it looks like these days.
So I think the situation is still evolving, but it is likely that we will have a situation such as we have with the flu vaccine, where particularly more vulnerable populations, again with flu, older persons or people with comorbidities, are offered and encouraged to vaccinate on an annual basis in order to provide ongoing protection. So we haven't quite got there yet, but things seem to be heading in that direction.
Yeah. Vaccine hesitancy is a very big problem, and to try and convince people at this point to go and get vaccinated, especially when the numbers are low, is, I imagine, quite a difficult task. You sort of see an uptick if there is sort of a lot of infections around and people then go and have the vaccine. But if not, it looks like it's quite low. And we have got a number of doses that are going to expire come the end of this month. And that, I imagine, is a lot of money hanging there and a lot of doses that could be given to people. Why the hesitancy? What is the worry with getting the vaccine that you are hearing?
So I think vaccine hesitancy is quite complicated. There certainly is a lot of misinformation. So we understand when people are nervous to take the vaccine, perhaps they're afraid of needles. There has been the situation has evolved very quickly. We don't really have a history of adults taking vaccines in South Africa. So we understand that there is some level of anxiety around taking vaccines. The amount of misinformation is really astounding, with all sorts of conspiracy theories, and in some cases, people seeming to enjoy or to thrive, to have an agenda of spreading misinformation. And that is really concerning when people place their lives and the lives of their families and communities at risk on the basis of misinformation. The two vaccines that we use in South Africa are very effective and extremely safe. So that does not mean that there are no side effects. Every medication and vaccine has some side effects. But the vaccines that we use, minor side effects are common, but those resolve in 1 to 2 to 3 days. And serious side effects are extremely uncommon. We have systems in place to identify, to monitor, to follow up any serious adverse events. So we will identify any new adverse events that we were not anticipating, and we do monitor to ensure the ongoing safety of our vaccines. But unfortunately, despite all of that, there is many unfounded allegations circulating on social media particularly, but other channels as well, that cause people to be anxious and to choose not to vaccinate.
I mean, sorry, we're running into news time, and I'm going to wrap this up now, but just my final question to you. Also, there were, and perhaps you can tell us if this was true or not true, but there was that whole list that was put out of the side effects from the Pfizer vaccine, that there were hundreds of side effects that were there that were only given out to the public after a lot of doses had been given. Perhaps you want to talk to that, because I think that has played a big role in people being hesitant about taking the vaccine.
Well, I think people have been hesitant for some time. There are side effects from the vaccines, but those lists and that publication is extremely what's the word? It gives the wrong impression entirely. And the vaccines do remain safe. We do monitor all the time, and particularly with severe side effects or adverse events following immunizations. Those are followed up, and none of that information has led to re-evaluation of the safety of the Pfizer vaccine within the scientific and international community.
All right, Dr. Lesley Bamford, thanks very much for talking to us, a specialist and acting chief director at the National Department of Health, reflecting on the 2 years of the national state of disaster in South Africa after the first case tested positive for COVID-19. That was on the 5th of March 2020 in KwaZulu-Natal.